Thank you very much for the invitation to speak with you today and for the opportunity to speak immediately after morning tea when everybody's on their sugar high and enjoying the day. So I'll talk to you about implementing the National Antimicrobial Resistance Strategy. Australia's got a national strategy, and as was heard in the introduction, together with the Commonwealth Chief Medical Officer, I co-chair the advisory group that established that strategy, which was endorsed by respective ministers. As antimicrobial resistance has increased, so too have the calls for national, regional and global efforts to slow its development, and I'm sure that you're quite familiar with many of the drivers of antimicrobial resistance. Tony mentioned the antibiotic discovery void. That is that there's a lack of alternatives to antimicrobials and lack of new antibiotics coming onto the market. Imprudent and unrestrained use, inadequate infection and prevention control, globalisation and international travel. We're not isolated here in Australia, we're very much a part of global trade and travel. Poor and slow diagnostics and substandard antibiotics. These drivers have resulted in international human and animal health organisations initiating a number of activities to address antimicrobial resistance. And the Commonwealth's approach to antimicrobial resistance is to deliver strategies that support the international efforts, that is the WHO Global Action Plan on Antimicrobial Resistance and the OIE Strategy on Antimicrobial Resistance and the prudent use of antimicrobials. In the animal sector, the World Organization for Animal Health, the OIE, is responsible for improving animal health and welfare worldwide. It sets international animal health and welfare standards for the prevention and control of diseases and for safe trade. Last year, the OIE launched its strategy on antimicrobial resistance and the prudent use of antimicrobials, which is aligned with the WHO Global Action Plan in recognition of the Global One Health approach. Following this, and earlier this year, the OIE adopted a resolution on AMR which emphasised responsible and prudent use of antimicrobial agents, the need for collaboration amongst One Health counterparts to develop international standards on AMR, a review by the OIE of the list of antimicrobial agents of veterinary importance, and ongoing annual collection of data on antimicrobial use in food-producing animals. The OIE also outlined an upgrade to its World Animal Health Information System, or WAHIS Plus, which is a dynamic, intuitive system to incorporate data on the use of antimicrobial agents collated from member countries. But this database is used principally to collect the disease situation across all of the countries for all of the diseases. And to that, they're going to add records on antimicrobial use. So what do we know about the antimicrobial use in Australia in both the animal and the human health sectors? As was previously referenced in the presentations this morning, the 2015 UK review on antimicrobial resistance showed that there is considerable variation in the volume of antibiotic use amongst countries as shown here. Among the countries examined, Australia had a low level of antibiotic use in agriculture, in contrast to our position in the human health sector, where our ranking is not as good. Although 2/3 of antibiotics are used in agriculture, this reflects the fact that livestock make up 2/3 of the biomass globally. Increased global population growth and affluence has led to an increased global demand for animal protein, and the use of antimicrobials in livestock production is expected to increase by a further 2/3 between 2010 and 2030. While the use of antimicrobials in agriculture is a focus of concern, particularly to our human health colleagues, the role that agriculture plays in AMR seen in the human population is not clear. Animals need to be healthy for our food safety and to prevent the occurrence and spread of zoonotic diseases, as well as for their own welfare. However, apart from preventing and treating disease in animals, antimicrobials are also used to promote growth in some livestock production systems. This is an area where we are working with various animal sector stakeholders to ensure antimicrobials of importance to human health are removed from products registered for growth promotion. Australia is very conservative in registering antimicrobials for use in food animals, particularly those of importance to human health. We do not approve certain classes of antimicrobials for use in livestock, and when approving antimicrobials, the potential for AMR development is taken into account. In June of 2015, Australia launched the first national antimicrobial resistance strategy, incorporating both human and animal health to minimise the development and spread of AMR and ensure the continued availability of effective antimicrobials. An implementation plan to support and flesh out the strategy was released last year following extensive consultations. The plan focuses on specific areas for action and includes a stocktake of activities currently being undertaken by stakeholders that contribute to the achievement of the objectives under the strategy. The first annual progress report was released this week and highlights the key activities undertaken in Australia in the first 2 years of the strategy, as well as areas for continued and future action. A key objective of the national strategy is to increase awareness and understanding of AMR. To this end, the Department of Agriculture and Water Resources has contributed to the development of the newly launched National AMR website, which was launched this week, hosted by the Department of Health. This website provides a central repository for trusted information on AMR and antimicrobial use, targeted at human and animal health professionals, the agriculture sector, animal owners, and the general public. The Victorian Government also hosts an excellent website, which will be a useful resource in supporting the collaborative approach to AMR education. In addition, my department has a dedicated AMR webpage to raise awareness and understanding of AMR. We also participate in the annual Antibiotic Awareness Week, which is occurring this week, and we have done in previous years, such as the event today, which links to global WHO and OIE events. Continued participation in these events has increased the profile of AMR and the importance of appropriate prescribing and use of antibiotics in veterinary clinics, on farms, and by livestock industries. We encourage others to join with these initiatives. Animal sector stakeholders have been actively undertaking activities promoting antimicrobial stewardship. Earlier this year, I wrote to all registered veterinarians in Australia about their responsibilities as veterinarians to undertake prudent and responsible use of antimicrobials to limit and minimise the spread of AMR in the animal sector. The Australian Veterinary Association has included fighting AMR as one of its 5 key priorities, promoting a number of initiatives and resources on antimicrobial stewardship in the veterinary profession. The AVA also has fact sheets and guidelines on veterinary use of antibiotics critical to human health and guidelines for prescribing, authorising and dispensing veterinary medicines. To support judicious and prudent antibiotic use, the AVA, industry and the Australian Government will collaboratively develop best practice antibiotic prescribing guidelines for livestock and horses. My department has funded a grant with the Australian Veterinary Association for the development of best practice antibiotic prescribing guidelines for pigs. Evidence-based guidelines for dogs and cats already exist, and the veterinary pharmaceutical industry has contributed guidelines for the preparation and use of compounded pharmaceuticals. The AVA has also undertaken a pilot trial in the ACT of antibiotic stewardship program in companion animal practice, which concluded in March this year. Animal Health Australia, the independent animal health body, produces information on farm biosecurity for livestock producers. Farm biosecurity promotes good on-farm biosecurity and prevention of animal diseases so farmers can identify the risks and incorporate measures to minimise them. In May this year, the department also funded Antimicrobial Stewardship project with the veterinary schools of Australia and New Zealand to develop an education model for veterinarians in practice, which is expected to be completed in April next year. Livestock producers also participate in various industry and supermarket-related quality assurance programs, which help to reduce the disease burden in their animals and consequently reduces the requirement for antimicrobials. In 2016, the Livestock Industry's Antimicrobial Stewardship Group was formed. This is an informal cross-livestock industry collective with members from a number of livestock industries, along with experts in antimicrobial resistance and antimicrobial stewardship. This group discusses cross-industry opportunities for aligning activities and efforts in the antimicrobial stewardship area. Some activities to date include engagement with key government and research stakeholders, the development of the Antimicrobial Stewardship Framework infographic and accompanying words to align language and efforts across industry, and identification of barriers that exist which impact all livestock industry efforts to progress antimicrobial stewardship. An important issue of interest both internationally and nationally is the use of antimicrobial growth promotants in the production of livestock. To assess the use of antibiotic growth promotants in Australian livestock production systems, my department is working with the relevant livestock industries, the APVMA, the Australian Veterinary Association and the veterinary drug manufacturers to explore options on phasing out the use of important antibiotics used as growth promotants in food-producing animals. Many antimicrobials used therapeutically and prophylactically are unfortunately also registered with a growth promotion claim. We're working to address this issue so as to be able to reach the point where Australia does not use antibiotic growth promotion in livestock production. And I note that there is a common misconception that antibiotic growth promotants are used frequently in the pig and poultry industry, which is not the case in Australia. This work will build on current work that an ASTAG antimicrobial list working group is undertaking to revise Australia's antibacterial importance ratings to develop a list of antibiotics that would be unregisterable for animal use. This will also strengthen the APVMA's ability to consider AMR impacts associated with the use or proposed use of an antibiotic product in animals. Stakeholder consultation will occur following development of the documents. So what is the surveillance situation in Australia in the animal health sector? Unfortunately, we do not currently have an ongoing national AMR surveillance program in the animal sector, which is reflected in this map showing the situation among various WHO member countries. A pilot surveillance program conducted some time ago to establish Australia's initial AMR status in animals did, however, indicate, with a few exceptions, nil to a very low prevalence of resistance to antimicrobials of importance to human medicine. While Australia is in a unique position and has a good story to tell with low AMR in the animal sector, baseline and ongoing surveillance data collection is necessary to provide assurance on AMR in the animal sector for product integrity and to meet the demands of our international markets. AMR surveillance proof of concept projects are currently being undertaken or developed in several food animal industries, including the chicken egg, chicken meat, pig and salmon industries. These surveillance projects will provide comparable data on resistance levels in key bacteria in various food animal industries and have taken into account OIE standards. The outputs will inform stakeholders in the AMR framework and help to monitor AMR status from an animal health perspective. Outputs from the pig and chicken meat industries are expected in the near future, and we hope that the other intensive industries will participate and current collaborators will maintain their partnerships in this important work. The department has also funded a PhD scholarship project researching mechanisms for surveillance of AMR in animals, and that's due for completion in December of next year. So what are the next steps for the animal sector? If we do nothing, then we face the post-antibiotic era with dire consequences for animal health. Additional and perhaps unnecessary regulation may be imposed on veterinarians and animal owners. We could lose the effectiveness or the availability of antimicrobials for animals, affecting their health and welfare. which goes against the ethos of veterinarians. Worse, calls from some sectors for a complete ban on the use of antimicrobials may become a reality. Through the broader implementation of best practice stewardship, we can counteract extreme calls for a complete ban on antimicrobial use in livestock production. An ideal vision for Australia's future in relation to tackling AMR would require an integrated animal-human environment One Health approach to surveillance, supported by the professions, government agencies, industry, research entities and the public. Stronger coordination of human and animal health in terms of surveillance, prevention and management. A One Health approach has proven to be very effective and efficient in Northern Europe. An integrated One Health system addressing AMR and antimicrobial use would incorporate international coordination as well with human and animal health sectors and industry bodies in Australia, and on a technical level would involve surveillance of both the human and animal sectors by testing for similar target organisms of public health importance, including standardised laboratory methodology and collating data on antimicrobial usage. Key data systems would also be needed, such as laboratory diagnostics with established network and submission pathways, information on drug supply, information on drug use. This data will need to be integrated to build a One Health profile by identifying and analysing AMR and antimicrobial use trends over time and location. This profile can then inform future policies and resources for livestock management, companion animal medicine and human medicine, produce key messages for professionals and the public, and importantly, adequate resourcing for this system will be essential. The future vision I outlined comes with certain challenges, however, which are currently limiting our approach in the animal health sector. Firstly, companion animals. Companion animals such as dogs, cats and horses share their lives in close proximity with their owners. We share our food, our beds, our homes with our pets, and this allows for the transfer of bacteria and resistant genes. As trade requirements and global AMR focus mostly relate to food-producing animals, AMR surveillance in companion animals is considered a lesser priority. A nationally coordinated system to monitor antimicrobial use and antimicrobial resistance in food-producing animals should also cater for the notification of AMR isolates in companion animals to provide a comprehensive picture on AMR. Secondly, there are no clear market drivers. Due to our predominantly extensive agricultural industries, restrictions on the use of some critically important antimicrobials in veterinary medicine and low use in animal production in Australia, we have a good track record with AMR. Consequently, unlike the Northern Hemisphere, who do not have similar systems, the record in the Australian animal health sector doesn't have a strong market driver to address this urgent public health threat. However, there is increasing consumer pressure on food retailers to source animals raised without antibiotics. We saw the first retail claims most recently. Alternatives to antibiotics are needed. We need to develop alternatives such as vaccines. The role of the environment is unclear. It's not clear whether the environment is contributing to AMR or is merely a recipient of resistant genes. And then the role of antimicrobial resistance in the food supply chain. Although there's no evidence that AMR bacteria in food is contributing greatly to the AMR we see in human health, more information is needed. In summary then, Australia has a relatively good record on AMR with low rates in most animal industries, but we cannot be complacent. We must continue the momentum of AMR activities in Australia following the release of the progress report of the implementation plan under the national strategy. Ensuring the sustainable and judicious use of antibiotics in both the human and animal medicine sector is critical to mitigating antimicrobial resistance. Given the complexity of AMR, continued and strengthened national One Health partnerships between the animal, environment and human health sectors and at the regional and international levels is essential.